Hello, this is Amy Smith with my project, Cerebral Palsy and Music Therapy. The reason I selected cerebral palsy is because I used to teach a class of children who were in a self-contained special education classroom, and several of the children had cerebral palsy. The boy in this picture reminds me of James, a young boy who was in a wheelchair, nonverbal, but he was very excited to come to music class, and you could tell by the changes in his eyes and his expression that he was very happy to play the instruments in my music class. I would like to share with you a short video that I found of a girl with cerebral palsy who wrote her own song titled My Own Superhero with her music therapist.
I might not have super speed or be able to fly. I might not have X-ray vision, but there's a strength inside. I'm my own superhero, even in times when it's not easy to be me. I find the strength to be a superhero.
It's very inspirational to see a young girl expressing her emotions through music, through her own songwriting with her music therapist. What is cerebral palsy? It's a group of movement or posture disorders due to an injury to the fetal or infant brain. Cerebral palsy is permanent, but it is non-progressive. It is quite common. In fact, cerebral palsy is the most common childhood physical disability. 2 to 2.5 children out of 1,000 are diagnosed with cerebral palsy. There are 4 types of cerebral palsy. Spastic cerebral palsy is the most common. It is characterized by increased muscle tone. The movements of the individual are usually stiff and awkward. It can affect parts of your body, for example, one side of your body, or the lower half of your body. The second kind is dyskinetic cerebral palsy. This is characterized by movement patterns that are usually slow or uncontrollable writhing or jerky movements. Atxic cerebral palsy is when the individual has poor coordination or walks with an unbalanced gait. And number 4, mixed types, is mixed types of cerebral palsy. There are many ways to diagnose cerebral palsy. The most common is motor skill assessments. There are many assessment tools doctors use to see if infants are reaching developmental milestones. But the brain injury can also be detected by an MRI, cranial ultrasound, computer tomography, or electroencephalograms. Children are usually diagnosed with cerebral palsy before age 2, and there are several common symptoms. Infants typically have developmental delays. There's a lack of muscle coordination and sometimes shaking. Stiff or rigid muscles and exaggerated reflex are common. Weakness in arms and legs or a crouched gait. There could be variations in muscle tone, some very strong and some very weak. And there can be delays in reaching age-appropriate motor skills, including fine motor skills like writing. Most cases of cerebral palsy are caused by a prenatal event, but there are still some cases in which we do not know how cerebral palsy is caused. The antenatal causes are congenital brain malformations, maternal infections during first and second trimesters, or maternal ingestion of toxins. Prenatal causes could be problems during labor and delivery, where the baby is deprived of oxygen. Neonatal causes could be problems like severe hypoglycemia or untreated jaundice. And there are a few instances of postnatal causes, If there's infections or injuries, for example, a near drowning or a car accident, those could also cause cerebral palsy. Individuals with cerebral palsy, and especially children with cerebral palsy, need help in many areas. Motor skills is a big one, speech and communication, cognitive skills, and social interactions. So, what are the ways to treat those needs? Number one, physical therapy is a very common treatment. But there are also medications that are used, some to relax muscles, and others to help reduce spasticity. Surgical treatments are also useful, especially in helping muscles move better, and external aids are very common, wheelchairs and walkers. Recreational therapies have also found to be effective, which include art therapy, sports therapy, and, of course, music therapy. Other secondary conditions that can go along with cerebral palsy include impaired oral motor function, mental health affected by chronic pain, and in fact, according to the Cerebral Palsy Foundation, 1 out of every 2 children with cerebral palsy have constant pain. And number 3, communication problems. And now moving to the research for music therapy for individuals with cerebral palsy. My assessment on this research is that there have been very few studies that relate directly to cerebral palsy since the year 2000. There were some earlier studies done in the 80s and 90s and a few in the 70s, but since 2000 there has been very few directly related to cerebral palsy. Some of the studies I did find include the following. Number 1, improving the gait of individuals with cerebral palsy was very effective using music therapy in 2007. Patients who had cerebral palsy who listened to music reported less anxiety but no difference in pain while receiving acupuncture. Number 3, there were positive changes in behavior over time by using music therapy with clients who had CP. Number 4, positive results were found in 2009 using an augmented reality keyboard, which is a keyboard that has been adapted for the child who had cerebral palsy. Number 5 is music therapy was effective in helping individuals with communication disorders improve their intelligibility. And again, this is not directly related to CP, but so many individuals with CP do need help with communication. And number 6, improvements for children with CP after engaging in music therapy with gamelan percussion instruments. Those are usually metal gongs and xylophones, including improvements in posture, gross motor function, confidence, and cognitive function. And that study was done in 2010. There are several studies that are related to cerebral palsy. For example, working with children with developmental disabilities and speech disorders, and there has been some research done prior to 2000. Here are some examples. In 1984, Ford found that music therapy was effective in aiding in cognitive, physical, social, and emotional growth of children with cerebral palsy. And in 1993, Cohen did a study determining that singing and rhythmic instruction was effective for children with neurogenic communication disorders. So there are several music therapy approaches that can be effective for children with cerebral palsy. The Nordhoff-Robbins music therapy, neurologic music therapy in the expressive arts, and community music therapy would be great for social interactions. My conclusions after doing this project is that yes, music therapy is effective in helping children with cerebral palsy, but more research is needed for determining the best practices. I also found in all of the studies that music was a significant motivator for children with cerebral palsy. And I've noticed through my research that there seems to be a growing awareness of CP. The ABC network has recently released a show called Speechless, and it includes a boy, an actor, with cerebral palsy. And the actor himself does have cerebral palsy, and he plays a boy on the show who is nonverbal with cerebral palsy. There were many references that I used to create this project, and I found that one of the most useful resources was the Cerebral Palsy Foundation website. There were great resources for children, adults, teachers, and therapists, or anyone who may have contact with someone with cerebral palsy. Thank you so much for watching. I hope that you are now more enlightened about cerebral palsy.